Goal setting is vital for success in all aspects of life, from academics to athletics and beyond. It's also vital for patients' care as it helps keep patients on track and provides clear objectives for their treatment. That's where a SMART treatment plan comes in. What are SMART goals? SMART is an acronym for specific, measurable, attainable, relevant, and time-bound. It is a goal-setting technique used to create practical goals. The SMART criteria ensure that goals set out are specific, measurable, achievable, relevant to the patient's needs, and include a timeline for completion. This plan can be used by therapists, counselors, psychologists, mental health professionals, and doctors to ensure patients receive comprehensive care. Additionally, getting SMART goals helps measure progress more accurately over time and make adjustments if needed. We can see the structure of the worksheet through our sample template. The SMART worksheet starts with a problem/need. In this case, it is anxiety in public, particularly during work-related gatherings. The patients then need to plan a long-term goal and short-term goal while setting a target date for the long-term goal. After the patient will plan for intervention, this is what patients will do to focus on reaching his goal and how he will track his goals. There is a section for the duration they will give themselves to achieve the goal and target date. To find our SMART treatment plan, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.